Welcome to The People's View, a program dedicated to discussing local, state, and national issues and their effect on the American people. The People's View provides a platform for state representatives and national figures to present their viewpoint. Whether it's social, economic, or financial topics, you'll hear it on The People's View.
Hello, this is Carl Seidel, co-host of The People's View. This program is sponsored by the Nashua Republican City Committee, and if you want to find out anything more about them, go to our website at nashuagop.org. And we meet the second Thursday of every month at the Crown Plaza Hotel. If you want to join us for interesting speakers, look on the website to see what's coming up. And today we have Pam Tucker, who's one of the representatives up here and heads up one of the co-chairs of the House Republican caucus.
Alliance, yes.
Alliance, excuse me.
Yes.
And it's a caucus of more conservative Republicans, I guess you might say.
It is. We consider ourselves a principled people, and of course every Republican within the caucus is invited to come and attend our meetings, which are every Tuesday morning. And I'll briefly talk about that. What we do is we look at the bills that are coming up on the House calendar, as well as those in committee and on the House floor, and we take a position on those, especially those that are on the House floor. And we take it based upon principles on the U.S. Constitution, on the state Constitution, and of course the party platform Republican that we are. And that is how we take a position on the bill. Very principled in terms of how we do it. We do not allow personalities to get in the way because, as you know, we don't always get along or agree with everybody. But if we stay with our principles, we will never falter in that regard. And we take a vote democratically whether or not we're going to support or decline a position, or no recommendation if we cannot find a federal, state, a constitution, or party platform issue with the piece of legislation.
So select pieces of legislation that you come out with your pink sheet,
yes,
which
we do.
is something that people reference from all sides of the aisle.
Yes, we do. The pink sheet, as well as the scorecard, which comes out every 3 months, or there. As soon as we have enough votes, is when the scorecard comes out. And what the scorecard does is it provides a percentage of how each representative voted in terms of those principles. And it is a good scorecard, and I think it's very accurately named, because it can see, is your representative voting what you wanted to vote on, and it lists the bills in case there's a bill that we take an issue on, say gambling, which I don't believe we would take a stance on it other than against it because it's in the party platform, but to see if your representative voted for or against gambling. That happens to be a big issue, so I thought I'd mention it. And you can see what the bills are that were used to rate it, and is your representative there? Did they vote 100% of the time, 80% of the time? And it's only based, of course, on roll call votes, because that's the only way we can really determine voice votes and division votes, where we just press the button. Can't really tell how people voted then.
Right. On that matter, how can people find out what the pink sheet is, people who aren't in the legislature? How do they go to the web to look it up?
That's a good question. We are NHHRA, New Hampshire House Republican Alliance.org. And the pink sheets that are up there right now are obviously for now, but the scorecards are from last year because we've had a whole turnover of reps, and we're just looking at putting new scorecards up shortly based upon, I think we have enough votes now to start putting up scorecards.
Well, I hear that you've had turned some around. Yesterday was a vote that you won something on the gun laws.
Yes, on whether the immunity for the owner of guns. There was a bill that came up, and it was, are we immune to prosecution on the laws if someone steals your gun? And it came out ITL out of the committee, and thankfully there was a good group of people who gave very solid arguments on the House floor. We roll called it, and we overturned that committee report. As you know, that's not a thing that happens often. There was also another one that was overturned on the House floor, and then I believe it was last week we also overturned a committee report on the House floor. So if we're keeping score on overturning committee reports, we're up to 3.
Well, I think your logical arguments do take hold on some of them once in a while, and it's not as cut and dried a politically partisan type of vote.
Absolutely not, and we'll talk about that a little bit more when it comes into education, about partisan votes versus nonpartisan votes. But I believe that there are certain people who, of course, like to be heard on the House floor, as we know. But if you listen and you're undecided on an issue and you listen to both sides of the argument, I believe you can be persuaded to see the other side and perhaps change your vote and have it less partisan, because I truly believe most of us up there, or almost all of us up there, want to do what's best for our constituents first and for our state. And if we keep those principles and thoughts in mind as we vote, we will make the right decision for our people.
Let's go right to the education then, because as you say, that's one of the highlights of most people who are running for office, is taking care of the education of our children, which is one of the more important responsibilities of the state and local governments. What do you see happening with this argument for the school, for the scholarships, that the business-supported scholarships?
Yes. Well, as you know, HB 370 is a repeal of SB 372, the Senate Bill 372, that we overrode the governor's veto on last year. And that is a bill that allows for businesses, tax dollars aside, this is private money. This never hits the public coffers, so you can't say that in any way this is a voucher program. This is private money, just as you would donate to your cancer society, your local Y, that can be used specifically for children to go to schools, and schools of their choice. And when we say schools of choice, we're not just talking about private schools and parochial schools. We're talking about other public schools too. Now, if you're fortunate enough to live in a school district where you have a great public school and you like the teachers and your child is learning in that environment, great. And you know what? Public schools do serve well for most of our students. But there are those students who don't fit into that mold. We know that one size doesn't fit all when it comes to education. And in fact, my child, we thought she could get a better education 1st through 3rd grade in another school. And we were fortunate enough, we lived in an area that there was a Montessori school close by, and we had the financial wherewithal to send her there, to get her that better education that was for her. And I have 2 other daughters who've been in the public school pretty much the whole time as well. But we had that choice, because we're, again, right demographic area, right geography area, but there's other people who don't, and that's your middle and lower income people. They don't have those choices. And what Education Scholarships does is give them those choices. The average scholarship size is going to be right around $2,500. We've had over 400 students in New Hampshire apply already, and they're looking for that choice, and the reason they're looking for it is because the school that they're in right now is not fitting their needs. Be it the mother who wants to get their kid out of the school because there's gangs or drugs, this $2,500 might make the difference between her kid staying in a public school that isn't working for her child, or going to a school that she knows her child can excel in. And we found, and I told all of this on the House floor yesterday, we have over 400 children applying. The average income level is for about $45,000 and it's a family of 5. So we're not talking really, this is not for the upper income level people, this is for the middle and lower income.
Some people say that $2,500 isn't going to be enough to pay, but they don't realize that a lot of the schools will give you like a scholarship to match that scholarship or something like that, or you know, some kind of discount anyway, so it allows that $2,500 to be enough to get them in, and it doesn't take away from the money that's going to the school district. I mean, it's only a certain amount of money, which is less than the full amount that is allocated per pupil. So they're actually getting more per pupil than they did before.
Well, there's exactly, and there's more money going to education overall, because you're going to have the parents is contributing, plus the average $2,500. Now that can mean it could be the $700 that's going to the kids who are being homeschooled, or it could be a $5,000 scholarship, which we know will certainly make a difference. And so little things like that will add up and provide for more dollars in education.
That's right.
And in fact, I believe Governor Hassan's, when they went through the budget, and it says that this program is actually going to save the state $500,000
That's right.
in terms of education funding. So we're saving the state $500,000. We're providing choice to middle and lower income families, and we're getting kids the best education we possibly can. It's a win-win for everyone.
All the way around.
Yes.
And I agree with you. I've been to some charter schools, and I think they're excellent for what they do. They focus on a certain type of student, maybe, or maybe a couple of different types, but they really work with the student and allow the student to progress at their speed, which is amazing.
Yes, and we need more charter schools
Yes.
in the state, and I know that Governor Hassan has also said she's going to champion them. I would like to see charter schools open up where they're needed and not just where they think they are needed by the state. Meaning if there is, you're in a high area of students, there's a lot of public schools, maybe they don't think they need a school there, but you know what, they might need a charter school in there because it's going to provide that alternative education that you're talking about, and that is a public school as well.
And that is something that we need. We need to pay attention to it. I hesitate to say that when the article that came out in the newspaper in Nashua about some of our current high school graduates that went into community college and they couldn't cut it right away. They had to go into remedial classes. And now you have high school students that, how did they graduate if they have to take all these remedial classes in English, math, or whatever?
That's right, and I've talked to the people at the community college. We have Great Bay near my house, and they are taking a lot of students in and giving them the remedial education they need. We had a bill in last year, I think it was Representative Greg Hill, who put it in to look at that and what the costs are of all this remedial education. Our K through 12 should be having them ready to go to a four-year university if that is what they choose to go to.
Well, let's go into some other things that you were interested in and in this session of the legislature. What were you doing with the medical area?
Medicaid expansion.
Yes.
That's a hot topic, not only in New Hampshire, but across the country, as we're finding out. I read an article this morning that was in the Wall Street Journal yesterday about the baby elephant. And I got to be honest, I think that is probably the best analogy when we start talking about Medicaid expansion. The government's offering us a baby elephant, which is we will pay for your Medicare expansion up to 138% of our poverty levels. And that's fine, they're going to feed it for those first couple years. Well, what happens to that baby elephant in a couple years? And they're going to go down to 90%. So first off, we're going to have to pick up the other 10%. There isn't any guarantee, and I know the people who support it say, oh yes, the government pays. Well, they don't pay for special education all the way like they promised they would. So there is no guarantee that the federal government is going to be paying for the Medicaid expansion. And the other piece of that is, it's fiscally irresponsible. We're on the federal level. We're already borrowing nearly half of our dollars. What is it, 46 cents of every dollar is borrowed. That's on our kids' backs, perhaps your grandchildren's back. We're going to run out of money eventually. It's a fiscal nightmare that's just waiting to happen. We can be part of preventing that if we choose not to continue to take these federal dollars that are being promised to us under false pretenses and say no at this point. We can't afford it, we can't fund it. And the argument that is made that say, well, if it's not working for us, we can get out after a year or two. Well, wait a minute, we just got in it because you said it was going to work and it was going to save us costs. Now to get out is the better alternative. I don't think we can have it both ways. And the best for New Hampshire is to not get involved in the
first place. I hear that some of the proposals on the federal level are to allow people, if they change the criteria or the reimbursement for it, to just end it, though.
Well, I'm sure the laws and the criteria will change as it goes along and we find out how expensive it truly is.
Well, I agree. It's something that isn't really funded properly. And that's something we've got to look at the valuation of some of these programs. Are they really doing things?
We do. We have to look at them before we just jump in because the federal government says, hey, this is a great idea. Another example of that would be the healthcare exchanges that they want to set up in our state. We know that basically that can be an unfunded mandate for us if we have to do it. Right now we're looking at the partnership exchange. I would definitely think we should stay with the federal government setting it up so that way we are in no way involved in putting more money into it on the state level. Because as you know, we have a very, very tight budget, and we're just not going to have the money to fund any part of that. In fact, last year when we were looking at healthcare exchanges, it was estimated a state of our size would cost anywhere between $10 and $18 million to pay to set up a healthcare exchange. We're already looking at trying to cut the budgets and keep our costs down. To add another $10 to $18 million on an annual basis,
how do you do that?
How do we do it without raising taxes? And the taxes will go up on everyone.
Well, is there a way of being a partnership where if they stop holding up their end, we don't have to hold up their end as well as our end?
That's why we should go with the federal exchange.
Okay. So if they want to get out of it, then we're out of it.
We can get out of it. We'll see what happens. I mean, there's still some court cases going on that I'm aware of nationally.
Yeah, that is going to be a big thing, and I'm afraid that once these programs get started, they're never ending, and they just increase the demand for money.
It does, and I would question anyone who's seen their health care costs go down in this past year. I know our premiums have gone up, and our coverage is less.
Right, I've seen that. I was surprised. I went through, I expected to see something where they offered you less so you can keep your price the same, but I don't even see that. It's all both. You get less and you pay more.
Yes. So to say healthcare costs go down, you can't have it both ways. When you're adding more people to the pot here, it's that.
Well, we have a few minutes left. We'll talk about the overall budget. I mean, one of the things that I saw in Charlie Arlinghouse's article in the Union Leader last week, I think it was that we see like $20 million more in income, but $500 million more in expenses in the budget. How do they balance that? How do they pull that off?
I'm going to like to see that rabbit come out of the hat to pull off those monies. Again, it's going to go back to having to increase taxes somewhere. If you want to spend that money, you've got to find out where you're going to come up with it first. And this is something that we've preached, and we did it in the past biennium, is we figure out how much money we're going to have first. Just like you do at your kitchen table. You sit down, you say, okay, I have $1,000 to spend this month. We figure out how much we have, then we go spend it. We don't go out and spend $2,000 and then go back to our boss and ask for a raise for the other $1,000, now do we? It'd be nice if we could.
Well, unfortunately, credit's so easy. Some people might do it and just put it on the credit.
Oh, that's what our federal government's done for quite some time.
That's right. And the only fortunate thing about the low interest rates, the keeping it low, imagine if those doubled, I mean, how you were paying 46%, or 46% is borrowed money.
Yes.
I forget how much the interest rate is now, but if that doubled, just because the interest rate goes up to 6%, which is somewhat normal historically.
The interest rate on our debt would just crush us.
That's right. And something will happen, it'll be drastic then.
Oh, I think New Hampshire has been very fiscally responsible in terms of our budgeting the past session. And if we continue to budget responsibly, knowing how much we have come in, we will stay in good shape, and we won't run into these problems where when interest rates do go up at some point, where we raise our hands and say, where are we going to get the money? And it's not going to come from the sky.
Well, one of the big things that they're talking about is the infrastructure. And the 10-year plan for infrastructure in the state is very nice. Only trouble is it only has 5 years of money to support it. So what do we get to year 5 and we have nothing? I don't know how that's going to work out. I know we looked at that when I was served on Public Works Committee last year, and we wondered about that too. And I don't know how that's going to be addressed now. I mean, they talked about a gas tax and registration fees.
Yes, and again, we look at taxes, that's always the first place to go, is back to the consumers. And we know when you look at fees like that, they hurt the people who are commuting, the working people, the working families. I don't know that that's the route we want to go down. I know they want to look at more money, but have we looked at more efficiencies? And you were over there on transportation. I know that one of the Dakotas, their cost per mile for paving the roads is substantially less than ours. Has our state gone and looked at more efficiencies in our government and finding the best methods possible? I don't know that. I wasn't on that committee, so I can't answer that
Well, I don't think we did too much in that area, but we probably looked at it the more jaundiced side than some of the committees do, but I think that goes throughout all the agencies in the state. I look at the biggest agency, HHS, which has, I don't know how many thousand contracts with different groups, do they evaluate whether those contracts are fulfilled? Do they meet the objectives? They meet the price? Do they do the service their job?
Yes,
They change.
yes. Do they
we
deliver?
don't change anything. Once we put it in, it stays in.
I agree with you, and that is something. When we set up all of these contracts, say, well, this will take care of this problem, but we never follow up and say, well, did it fix it? And there is no, in business, as you know, there always is that follow-up piece of, are we spending money wisely? And the argument that has always come back was always, well, what if we didn't spend the money? And I don't think that's a valid argument, especially when we're dealing with very scarce taxpayers' dollars anymore.
Yeah, we'll see. Well, Pam, it's been very interesting talking to you. I think we'll wind this up, but we'll have you back again when it gets right close to budget time, okay?
Sure, I would love to come back.
And I'd like to hear more about some of the stories that went on and how we came up with some of the final numbers, because I think it's going to be something that's going to be hard to believe.
I'm certain it will. Well, thank you for having me.
Thank you.